The origins of the Wuhan virus, now widely known as COVID-19 or the novel coronavirus, trace back to December 2019 in the city of Wuhan, China. COVID-19, caused by the virus SARS-CoV-2, belongs to a broader family of coronaviruses, some of which have been responsible for past outbreaks, such as SARS in 2002 and MERS in 2012. Its initial emergence in Wuhan, a city with over 11 million residents and a major transportation hub, marked the beginning of a global crisis that would reshape the world in unprecedented ways. The initial cases of COVID-19 were linked to the Huanan seafood wholesale market in Wuhan, where live animals were sold, leading experts to suspect zoonotic transmission, the process by which a virus jumps from animals to humans. While some early studies suggested that the virus originated in bats, similar to other coronaviruses, the exact intermediate animal host remains unclear. Some theories have proposed pangolins as a potential link between bats and humans, though this has not been conclusively proven. By early January 2020, Chinese authorities had identified the novel coronavirus and sequenced its genome, enabling researchers worldwide to study its characteristics and develop diagnostic tests. The virus's rapid spread within Wuhan soon overwhelmed the local healthcare system, prompting lockdown measures in late January 2020, which would later be adopted by many countries around the world. COVID-19 spread rapidly beyond China's borders, aided by international travel and global interconnectedness. The World Health Organization, WHO, declared a public health emergency of international concern on January 30, 2020, followed by a declaration of a pandemic on March 11, 2020. Countries across the globe began implementing a range of responses, from stringent lockdowns to partial restrictions, in an effort to contain the virus's spread. The virus exhibited a high transmission rate, primarily spreading through respiratory droplets, and could also be asymptomatically transmitted, making containment exceedingly difficult. It affected older adults and those with pre-existing conditions more severely. Although younger and seemingly healthy individuals could also face serious complications. Symptoms ranged from mild respiratory issues to severe cases of pneumonia and organ failure, leading to millions of deaths worldwide. The impact of COVID-19 was profound on the global economy. The pandemic triggered an economic recession in many countries, as governments imposed lockdowns and restricted economic activity to control the spread of the virus. Industries such as travel, tourism, retail, and entertainment were among the hardest hit, with massive layoffs, bankruptcies, and widespread business closures. Global supply chains were severely disrupted due to the closure of factories and transport limitations, leading to shortages of essential goods and medical supplies. Many companies adapted by shifting to remote work, accelerating digital transformations and changing the nature of work for the foreseeable future. Governments responded with a variety of economic measures to mitigate the damage, including stimulus packages, unemployment benefits, and corporate bailouts. Despite these efforts, the world economy contracted significantly in 2020, with millions of people losing their jobs or facing reduced income. The pandemic had an immense impact on social behavior and mental health. Lockdowns and social distancing measures created a sense of isolation for millions of people, leading to increased rates of anxiety, depression, and other mental health issues. The uncertainty surrounding the virus, coupled with the fear of infection, intensified feelings of stress and emotional strain. Educational systems were severely disrupted as schools and universities were forced to shift to online learning. While digital learning provided a solution, it also highlighted issues of inequality, as many students lacked access to the necessary technology or internet services. This disruption created concerns about long-term educational impacts, particularly in lower-income regions. Social interactions also underwent a dramatic transformation as gatherings, events, and public life were restricted. Traditions such as family gatherings, weddings, and funerals were curtailed or moved online, reshaping cultural norms. Healthcare systems worldwide were pushed to their limits, as hospitals faced overwhelming numbers of COVID-19 patients. Many countries experienced shortages of personal protective equipment, PPE, ventilators, and medical staff, particularly during the early months of the pandemic. The need to allocate resources to COVID-19 patients also disrupted regular medical services, delaying treatments for other conditions and surgeries. Frontline workers, particularly healthcare professionals, faced immense physical and emotional challenges. Many experienced burnout, and some succumbed to the virus despite being at the forefront of treatment and prevention efforts. The pandemic underscored the need for more robust public health infrastructure and preparedness. Countries with stronger healthcare systems and swift government responses generally fared better than those with underfunded systems or delayed reactions. The development of COVID-19 vaccines was a remarkable achievement in medical history, with multiple vaccines receiving emergency use authorization by the end of 2020. The global race to develop, test, and distribute vaccines was unprecedented, with cooperation between governments, pharmaceutical companies, and international organizations. Vaccination campaigns began worldwide in 2021, although disparities in vaccine access highlighted global inequality. Wealthier countries secured large quantities of doses early on, while poorer nations struggled to obtain supplies. Organizations like COVAX sought to ensure more equitable vaccine distribution, though challenges remained. As vaccines became more widely available, they provided hope for a return to normalcy. However, vaccine hesitancy and the emergence of variants like Delta and Omicron posed ongoing challenges in achieving widespread immunity. The long-term effects of the COVID-19 pandemic are still unfolding. Economically, many sectors are recovering, but the pandemic has accelerated trends such as remote work, automation, and digitization. Socially, it has reshaped how people interact, work, and live, with increased emphasis on hygiene, health, and safety. From a public health perspective, COVID-19 has underscored the importance of global collaboration and preparedness for future pandemics. The virus revealed gaps in healthcare systems, economic resilience, and social safety nets, leading to ongoing debates about how to build a more resilient global society. In summary, the Wuhan-originated COVID-19 pandemic reshaped the world in profound ways, from its impact on human health to its lasting effects on economies, societies, and public policy. It will likely be remembered as one of the most significant events of the 21st century.